What if everything we've been told about autoimmunity is wrong? I'm Elizabeth Yarnell. After awakening partially blind one morning in 1999, a doctor told me my multiple sclerosis would put me in a wheelchair within 10 years. I refused to accept that as the end of the story, so I started investigating. Welcome to the Inflammation Investigator, the podcast that uncovers the inflammation lurking underneath your ailments. Because autoimmune and chronic conditions should not be viewed as death knells when they are actually alarm bells. I'm a traditional naturopath and founder of the Inflammation Academy. And in 2 episodes every week, we dig into what conventional medicine might be missing. If you're living with chronic or unexplained symptoms, this investigation is for you. Your body has been trying to tell you something. Let's start listening. Hi, and welcome to the podcast today. Are you sick and tired of feeling sick and tired? If you feel like everything that your doctor checks for you, all your labs come back normal, yet you're still feeling exhausted during your days, then stick around because today's conversation is really just for you. Dr. Jenny Tufenkian, a licensed naturopathic physician with 2 decades of experience, specializes in empowering health-conscious professionals to conquer long COVID and ME/CFS fatigue. Her personal battle with chronic fatigue inspired her to uncover its root causes, leading to the creation of a transformative system that addresses the 5 core root causes of chronic fatigue and ME. This approach helps those overwhelmed by exhaustion regain their energy and vitality, allowing them to fully embrace life once again. Combining a thorough functional medical approach with deep subconscious work, Dr. Tufenkian's method facilitates significant shifts in both physical and energetic well-being. She believes in a holistic healing process that integrates the physical, mental, emotional, and energetic dimensions, emphasizing the body's inherent ability to be vital. Dr. Tufenkian earned her medical degree and completed her residency at National University of Natural Medicine. She's also a mom of 2, happily married, and loves her time outdoors and in the kitchen, and a personal friend of mine. So, Dr. Jenny, welcome to the podcast.
Thank you so much for having me. It's such a pleasure to be here with you.
Well, I am so excited to talk about this because I often hear in my own clinic about people who are suffering from chronic fatigue all the time. And their doctors, they go to doctor after doctor after doctor. In fact, most of them, I like to say, have a medical file that is like inches tall by the time
Yes.
they come to me.
Yes.
And their medical professionals, try as they might, have not been able to figure out what is going on with them.
Mhm.
So go ahead.
Yeah, it's unfortunately incredibly common, and I think the people that are diagnosed with chronic fatigue or long COVID, they experience that frustration over and over of knocking on doors and trying to get help from their doctors, and these well-meaning physicians just don't really know what to do with them. And then I think there's a whole other group of people who are exhausted and they don't even realize that this is what's happening to them, that they have one of these conditions. I'm always surprised at how many people come in saying they're tired, but they don't identify with having MECFS or long COVID.
And we want to go into what does MECFS mean.
Mhm.
And I think I want to maybe come back to the maybe inherent misogyny in our medical system that kind of dismisses chronic fatigue.
Yes.
And I hear this all the time from my own
Mhm.
clients that, well, their doctor's like, well, you just need to get more sleep.
Yeah. Yeah. Yeah, I mean, it's definitely there. This is a condition that impacts women more than men. Men do get it for sure. And there are lots of men in my practice who I'm working with and they're experiencing, great results. But the women, but it's more likely to impact women. And there is this thing where when these patients have felt just so dismissed by their practitioner, and I've literally had doctors, pat the woman's hand and say, now, dear, you just had a couple kids, you're tired, or we're all getting older. And they're freaking 37 years old. It's like, give me a break. It's BS. And there is that whole hysteria, like this vision of the woman who has hysteria and needs to just be calmed down. And so these people who keep coming back to the doctor saying, I still don't feel better. This isn't working. I need something else. Can you please help me? It's so easy for the doctors to then just be not know what to do and just push them down the hall to the psych department and say, maybe you're just depressed, or maybe you need an anxiolytic or something, and it can feel it can feel very disempowering. Yeah.
Yes, yes, that is, and that could be an entire podcast
Yep.
about this concept in our medical world, our conventional medical world, that women maybe can't be trusted with really accurately reporting their own symptoms, and they're all in their head, right? I have a friend who is an emergency medical physician,
Yeah.
and he would talk about his people who would come in, and he would just say, "Oh, she came in and she was reporting all of this stuff, but we just looked at each other and we're just, oh, she's just crazy. There's really nothing wrong with her.
Yeah.
She
Yeah.
just wants attention."
Yeah. Yeah. I mean, what I always tell people, and I think for those of you who are listening to this, nobody knows your body better than you do. You know your body. You know what's going on. You know if something is working or not working. You know that. And so trust what comes to you. Trust your intuition. I think, part of the patriarchy is not understanding this deeper wisdom that we all have access to, male and female. We all have access to this deeper knowing inside of ourselves. And by tapping into that, we can often make huge changes in our lives and in our health. And so that's the piece that is coming in now, right? We're coming to appreciate that more, that does have value in the medical world.
Yes, yes. I like to say, if I get in a car accident, by all means, take me to the nearest hospital, put me
Yeah,
back together. That's what
totally.
medical professionals excel in.
Yeah.
But if I have a long-term chronic issue, it's hard to find the right solutions in our conventional medical system.
Yeah, the way I say it, I totally agree. And the way I say it is that these conditions, all the inflammatory conditions that you talk about here in your podcast, and MECFS and long COVID, they don't fit into the conventional system that's limited by time by the insurance companies, but the system is literally built on these doctors having you have symptoms. Through the symptoms, they rule in and rule out things. They do a test to confirm whether you have that thing or not. Then they give you a treatment, and then they see if you feel better and if the test numbers have changed. And that's the system, and that's how it's supposed to work. And these conditions don't fit into those neat, tidy little diagnostic boxes. And that's the problem, because there isn't a test to tell whether you have MECFS or if you have long COVID. It's just based on symptoms, and the systems vary wildly. We don't all present in the same way. So one person with long COVID presents differently than another person, has different signs and symptoms than somebody else with long COVID, and it makes it more challenging for doctors. And again, the system just doesn't support the doctors in figuring that out and working on that. And I mean, there's a lot of different reasons we can go down as to why that doesn't work, but that's usually what I see. And I agree. I think you're better off working with somebody who understands what these conditions are and has the time to work with you to really take a good history and look at the different root causes and the health foundations that need addressing so your body can get back into balance, so you can experience that mental clarity and that energy again.
I think this is a good segue to actually define what is
Yeah.
MECFS, long COVID. These maybe are acronyms people aren't familiar with. What does it
Mhm.
mean?
Yeah, absolutely. It's great. It's a really great question. So, MECFS is what we call this condition in the United States. So, there's a condition called chronic fatigue syndrome, and that's what it was called in the United States for the longest time. And in the 1990s, there was a big Time magazine article that came, or maybe it was Newsweek, that said, it's the yuppie flu, chronic fatigue syndrome. Yeah, that's actually when I was first diagnosed with it. And I was like, I don't want the yuppie flu, which is not true. It goes across all socioeconomic backgrounds and everything. It's not just for people with money. And the chronic fatigue syndrome is really an awful name to name a condition because right in the name, first it says syndrome, so it's not a disease. It says chronic fatigue. And so you go to your doctor and you tell your doctor, I'm tired. And they're like, in their head, they're like, honey, I am on hour 27. You are patient 102. You want to talk to me about tired? You know?
Hmm.
It's so easy. So many people feel tired. And the truth is that people with chronic fatigue syndrome have a different kind of tired than just regular tired. But it's very hard to explain that because we don't have that in our language. So, chronic fatigue syndrome is the terrible name that this condition used to be called in the United States. The rest of the world called it myalgic encephalitis. And myalgic encephalitis means inflammation of the muscle in the brain. We now know that that's exactly what's going on. There have been PET scans used for research where they put dye in 50-year-old women who have MECFS compared to 50-year-old women who don't have MECFS. And what they see is in the PET scan, there's all this inflammation, and the inflammation is in the brain and in the body. So it is myalgic encephalitis. And and so there is a movement now trying to get the United States to call it this more appropriate name, myalgic encephalitis. But it's a lot to get your mouth around. And and there is still the old guard. So that's why we do the CFS/ME to kind of as we're building the bridge of definitions here. What I also say is myalgic encephalitis, if you tell your neighbor that you've just been diagnosed with myalgic encephalitis, they're so much more likely to bring you lasagna or offer to drive your kids to school than if you say, I have chronic fatigue syndrome, and they like roll their eyes and go, yeah, I'm tired too, you know? So,
Right, right.
yeah. And then long COVID. I've been working in the chronic fatigue myalgic encephalitis space for decades. It's part of my personal journey. And when the pandemic hit, I was like, uh-oh, we're going to have a second pandemic of myalgic encephalitis because the root causes, two of the five root causes are high amounts of stress, and the second is a viral infection. And so here we have the whole world under this crazy amount of stress. And then we have this infection coming in that the body doesn't know how to deal with. What's going to happen? And I didn't know it was going to be called long COVID, but that to me, long COVID is another version of myalgic encephalitis chronic fatigue syndrome. It's under the same umbrella. Now that said, the SARS-CoV-2 virus has its own kind of unique signatures and patterns, just like Lyme. Lyme can turn on MECFS in a person. Lyme literally shapeshifts. It goes from spirochete to cell wall form, different things in your body. And so it has its own personality as you're trying to work on that as a root cause to try to treat somebody to get their energy back. The SARS-CoV-2 virus is tricky. You know, people, you think you're over it with long COVID, you think you're getting better, and then the tail comes up and goes, whoop, nope, no, you're not. Or, you think you're treating it, you're going down this one direction that takes a sharp left turn and you have to change it. So it has really some very unique things in terms of how it behaves, but also in terms of how it impacts the body, which I'm happy to dive into if you'd like. Yeah.
I definitely want to dive into that, but first let's talk a little bit about what is your story? How did you get here? What brought you into this field that is, I'm going to say, understudied?
Yeah, it really did choose me. I was a second year medical student and I felt literally on top of the world. I'd aced my board exams. My kid I went to school when my child was really young, my first child, and he was finally sleeping through the night. And I just felt like, okay, I can do anything. It's time to have a second child. And so, worked on getting pregnant, got pregnant, had a miscarriage, which was sad and grieved that and went through all
I'm
that,
so
and then got
sorry.
pregnant again and ended up having a second miscarriage, but this one was at a second trimester, so I was at 17 weeks. And
Oh,
yeah, and so hemorrhaged, passed out in the bathroom, had to be rushed to the hospital,
oh, how
and it
awful.
would have been another. statistic of a woman dying in childbirth if I had not had appropriate medical care, which is really another pertinent thing at this time because not all women have access to that care, even in the case of miscarriage at this time, which is awful as far as I'm concerned.
Ugh.
And but that whole experience really threw me into what I call a dark night of the soul. I'd also lost 5 people that year that had died, one, suicide, cancer, car accidents. I mean, it was just a whole lot of stuff.
Oh,
And being in medical school with a small child, there was a lot I wasn't doing in terms of giving myself space and time to address those things. Anyway, the universe slammed me into my bed and I literally couldn't function. I had ice up to my knees. I was exhausted. A high energy day, I'd put my head on the pillow. Low energy, I'd stare up at the ceiling. I couldn't handle the energy of people walking in the room. I couldn't eat. I couldn't sleep. I was filled with anxiety. I had hormone changes. I was going through a suicidal ideation. It was really bad. I had to be walked to the bathroom, and I literally stayed upstairs in my room for months. I didn't even come downstairs.
oh
I
my
couldn't.
gosh.
Yeah, I was really sick. And people and came back to me and later thought I was going to die at that point. And I think I there are a couple of things that happened where I just chose that I wanted to live, and there are a couple of key
Mhm.
moments where I decided to live. And anyway, that threw me into that. And I was able to get this amazing subconscious hypnosis therapy. A woman came and worked with me in my house. And that really made this huge shift for me where I was able to move from the bed to the couch. And I no longer had the anxiety or the suicidal ideation. I really had shifted my mental emotional state. And I had learned a lot on the energetic spiritual. It was a very spiritual opening for me. Yet I still was left with this body that was exhausted. And it took me years to figure out what it was, but I did finally work my way out and I got 150% better. And that's when I realized that these people that are at death's door, literally, the body has the ability to regenerate. It really can, given the right environment, given the right tools, addressing the right root causes. And the final piece for me that time was getting all 22 of my mercury amalgams out and detoxing the heavy metals out of my body. And
Oh,
that was the
wow.
flip from I feel like I'm 102 to I feel like I am like 24 again. I was like, it was amazing. So I went and did all the big things, open clinics, had another kid, worked crazy long days, was a mom, did all the stuff, and didn't think I'd ever get it again. Worked with really complex chronic patients. And then I had a second crash where I realized that relapse is so possible. And it was at perimenopause, so I was more in a pro-inflammatory state with my hormones going like this. I
Hmm.
had a couple of injuries. I was in severe pain. I couldn't sleep. And all of a sudden, I started tanking fast. And I got very, very sick again, but I had to keep working or else I would have gone bankrupt. And so
Hmm.
I had to figure it out. And that's what I did. And it was amazing because I had the gift of the universe of all of these patients coming to my clinic in droves with chronic fatigue with all these symptoms. And that's when I was able to map out that there are these 5 root causes, and each one has its own clinical pearl and way that you can rule in or rule out whether your root cause is from your mitochondria or from a virus or from toxins. And it really helped me be able to support these patients so that they could get their life and their energy back. So that's been my journey. I ended up getting long COVID as well, which allowed me to experience what that felt like from both sides of the desk as well,
Hmm.
and allows me to really understand how it is unique.
Wow, there's so much there to
I
unpack.
know it's long.
No, no, but it makes so much sense in so many ways. Okay, so you talked about 5 pillars and you mentioned three of them. You
Mhm.
mentioned toxins, you mentioned mitochondria, you mentioned viruses. What are the other two?
Yeah, the first one is what I call the gateway root cause, which is that hormone triangle where the adrenals, the thyroid, and then the gonads, ovary, or testes, that is that triangle that likes to work like a symphony and be in tune with each other. And if one is out of tune, the others also come out of tune and get dysregulated. I
Hmm.
call it the gateway root cause because so often in this culture, we're really addicted to the stress express. And I know I was. I mean, what was I thinking? Like I was already in medical school. Is this really the time to have a newborn when your child is like 4 other child? Anyway, so but there's this. But I think that in this culture, it gets addictive, that stress response. And I think that when that hypothalamic pituitary axis, or what we call colloquially the adrenal gland, gets dysregulated, it's really easy for the body and the immune system to get altered, for us to be more in that pro-inflammatory state, and for us to become vulnerable to some of the other root causes. And then, and so, yes, so it's react some sort of infection. It can be viral, bacterial, or fungal. Mitochondrial dysfunction, which there's many different pieces of that that we can break down if you'd like. And then there's toxins, which includes mycotoxins, heavy metals, pesticides, herbicides, all the stuff. And then the fifth is that limbic amygdala insula, that part of the subconscious mind that connects with that vagus nerve, which is the longest nerve in the body that connects to all the organs. And there's this communication pathway between the organs and the brain, always saying, are we safe? Are we not safe? Are we okay? Are we not okay? And that can get stuck into a stress place where we are not safe, get the body stuck into sympathetic overdrive, and can kind of forward feed a lot of these symptoms. And when that's dysregulated, it can actually amplify your experience of fatigue, your experience of pain as a way of safety. It's literally trying to tell you, it's basically the limbic brain has said, I don't know what's going on, but it is not safe for you here. It is not safe. I'm going to make you feel pain and exhaustion. So you go in your cave and hide, because that's all I can tell, that it's not okay. And so, yeah, those are the five.
Wow. And I think certainly, certainly the fifth one for sure is really not addressed almost at all in our medical community unless you're seeing under psychiatric care.
Even in psychiatric care, I don't think most psychiatrists that I've met to this day don't really see that in the same way. Psychiatric care, yes, will look at how's your mood, how are your emotions, how are you
Hmm.
managing your mood and emotions? Do you have skills and abilities? Or here, let's try medications, or let's try some behavioral or cognitive therapy. But what I'm really talking about is the subconscious mind. And the subconscious mind is something that has been absorbing every single emotion, visual, auditory experience you've had since you were in utero. And now we have studies to show that we also inherit beliefs and experiences that can come through the genetic line. And those go into the subconscious that start to create those frameworks, or for am I safe or am I dangerous? So those of us that have inherited more genetic trauma, or our moms were stressed out when they were pregnant, or dad was yelling, or, big brother or little sister was doing these things when we were little, we start building this framework of I'm not as safe. And so then your whole life that's going filter, but it's all in the subconscious mind. And the medications don't get to that piece. And they just cover up the symptoms, but they're not actually addressing the root cause of what's influencing the way that person's nervous system has been established.
And even I think talk therapy doesn't necessarily address that. So, what is it that you recommend people do for that part, that pillar,
Yeah,
when they're trying to heal?
and I want to say, I think there's value, kind of like to your analogy of going to the emergency room if you get in a car accident. I think there's value to
Hmm.
all the different therapies. There are times when medication is great. There are times when a psychiatrist is helpful, and there are times when talk therapy is great. And those are all good, but but you're right, they don't get to that subconscious piece. There's lots of ways of getting into the subconscious mind. There are many different therapies out there. EMDR, parts therapy, EFT, tapping, the EFT,
Hmm.
inner child work, family systems, doing some of the psychedelic therapies, are that's part of what they're doing, is they're taking the frontal lobe and going, here, you just kind of hang out over here a little bit. We're going to disconnect you so
Right.
that you're not such the gatekeeper, so that we can
Uh-huh.
get some of this other stuff back there. And those are some of the ways. In my clinic, I've been trained in a couple of different therapies. There's something called Psyche that I've done training in. I do
Mm.
parts work, I do inner child work, and we do that. And it's always amazing when the client or patient is ready to do that work. It's beautiful, because I really see they have huge transformations with it, and it feels like it's like that changed so much, once you get out of those old beliefs that you're stuck in, and change that pattern.
Now, I know that you had mentioned to me another time that you use labs in your practice
Mhm.
that maybe aren't the most common labs that people are getting from their doctors. And when people get these labs from their doctors or the regular slew of labs from their doctors and they all come back normal, and then you run different labs that show different readings, what can you explain about that?
Yeah, so this happens a lot. It just happened this week. I had a patient who came in and she has been very sick with fatigue. She has a young child. She's really exhausted. She has frequent swollen lymph nodes. She sometimes has enough energy to go to the gym, and then other times that gym will just make her feel terrible. Sometimes she feels better, sometimes she feels worse. She has days where she's just on the couch doing what we call horizontal parenting, which I remember doing too. It's like, you color, I'm going to be here.
Right.
Oh, that's a beautiful picture. I like the purple.
I'm guilty of that myself at times,
Yeah,
for sure.
right. Yes. We all have our moments. And
Yes.
but she had been told by her multiple primary care doctors that all of her labs were normal. And I ran conventional labs, but one, sometimes I'm reading them differently, such as
Mhm.
looking at white blood cell count. For me, a white blood cell count below 5 means that that body may be dealing with a chronic infection, or there may be something going on with the immune system that's where it's challenged. And
Mhm.
her white blood cells were around 4, and that's to me would have been a flag for me if I'd been looking at her labs. But I'm also looking at chronic reactivated viruses and running panels on those. A lot of doctors don't feel comfortable running those for a number of reasons, which I can get into if it's not too much in the weeds for everybody. And I'm also looking at what's going on with her immune system in a little bit of a deeper way in terms of running some other labs in her immune system. Yeah.
So if someone feels like they have low energy, but then one day they have more energy, does that mean that they don't have chronic fatigue if sometimes they have energy and sometimes
Yeah,
they
it's
don't?
such a good question. Oh my gosh, that's such a good question because I think a lot of people think they don't have long COVID or chronic or magic encephalitis chronic fatigue because they wake up in the morning, they're like, "Oh my gosh, I feel great today." And it's
Mhm.
not until the afternoon that they feel tired. Or like you said, they have one day where they feel good and another day they don't, and they're just like, "Oh, I'm just having an off day," or it's just really confusing, but they don't think that that's it. But that's honestly so common to have good days and bad days. That's just a common thing with MECFS is good days and bad days. And then part of, I think, the job is when you're trying to uncover what are your root causes is to look at what is the pattern of your good days, bad days. Can we figure out what's triggering it or what is not triggering it? And also what does the fatigue feel like when it comes on? People that have real heavy cement-like feeling in their body, that really feels like a chronic reactivated virus to me. That's pretty common. Like reactivated Epstein Barr virus often feels really heavy in the body. And this patient that I was just talking about actually had an acute cytomegalovirus, which is it's in the same family as the Epstein-Barr virus, but it's a different one and
Mhm.
it's an acute infection. And so she was told by her MD that she was fine, there was nothing wrong with her, but they didn't even run that test. And here she has a, Western diagnosed acute infection of something that leads to fatigue. Oh.
Well, what do you do with a viral infection? You can't give antibiotics. That's not the solution. How do you treat these
Yeah,
acute viral infections?
so the thing is that these viruses, especially when they are reactivated in a body and they've been living with you for a long time, here's the thing that I would say, a couple things. One is that you've heard of the microbiome, which is all the critters that live in your gut, and then we have that on our
Yep.
skin and everything. But there's also this thing called a virome. And a virome are all the little viruses that live in us, and we carry them around. And that's just part of life. Of all the viruses in the world, we don't even have names for everything that's out there, and we don't have tests for them. And so most of the viruses we don't even have tests for. But that doesn't mean that you can't treat a viral type of pattern, or it doesn't mean that you can't treat a chronic reactivated virus, because we also have a whole lot of antiviral ways out in the natural medical world, in the natural world through botanical plants. There's a lot of things that can support your body to more effectively fight a virus. The way I think about it is that you want those if you're dealing with inflammation, if you're dealing with a mysterious invisible illness, chronic reactivated infections are one of the most common things that I see that gets missed by your physicians and even functional medicine practitioners. I see a lot of them not knowing how to test for these or not knowing how to read the lab values once they get them or not to be able to
Hmm.
treat them well enough. So to answer your question, is I have found that they really like to live in the bodies. They want to be there and they've learned how to adapt to your system. So they're very good at hiding. So it takes more than one thing to treat them. And the mistake I see a lot of people making is like, well, I'll just give 500 milligrams of valacyclovir, or I'll just do this one herb. And that's usually not enough. So I have a three-legged stool approach that I use. And the first leg of the
Uh-huh.
stool is doing an antiviral where we do and if there is a pharmaceutical antiviral that's a good match for the virus that we found and for the patient and for their body and everything, then that's a possibility. Or there are other antiviral things that you can do. L-lysine is an amino acid that can be very effective in helping some of these chronic reactivated viruses. And then the third leg of the stool is doing some combination of botanicals. Doing a combination I find is helpful. Botanical medicines are great because they come at the virus from lots of different mechanisms. And so it is like you always have to keep the virus guessing so it doesn't adapt and get used to it. And it's much easier to fight them off in that way. And many of these botanicals also naturally support your own immune system to fight off these infections. So we're also boosting your system. A lot of people with chronic fatigue have a suppressed immune system. And then the third leg of the stool is I use homeopathic nosodes. When we know the name of the critter and we have the ability, there's these homeopathic nosodes, which are different dilutions of a homeopathic remedy. So say somebody has cytomegalovirus or Epstein Barr virus or
Hmm.
herpes HHV6 reactivated. We can do potencies where we do ascending doses, different types of potencies going up and then going down. The way I explain this is that in World War II, the fighter pilots were able to fly under the radar and go in and bomb different countries. Like that's how Germany was demolished, was going
Right.
below the radar. A lot of these viruses go below the radar of your immune system, so it doesn't see it, so it doesn't attack it. And some of these viruses are like the Harry Potter invisibility cloak, where they actually put on this thing and they hide. They're like, I'm not here. And they're right in front of your immune system, but they're not here. And they're hiding inside your mitochondria. They're sucking your energy away. And they're very good at doing that. And so the way I visualize what these homeopathics are doing is that they're like showing a mugshot of what the virus looks like at different concentrations, different images, different angles, different levels of clarity, and kind of saying, this is what EBV looks like. If you see it, attack it. Hey, this over here is what EBV looks like. If you see it, attack it. And it does that over and over again. And usually between vials 3 and 5, people have a immune reaction. They feel a little bit worse. And then after that, they start feeling much better. I've really found this to be a very effective protocol to use with people
Hmm.
with these chronic complex infections.
Fascinating. I know that Epstein Barr virus, for example, is associated very strongly with multiple sclerosis, but of
Yeah.
course, maybe 95% of people have had
Yep.
Epstein Barr, and of course, not 95% of people have MS.
Right. Yeah, yeah. No,
So,
it is Epstein-Barr virus is, I mean, it's behind Hashimoto's thyroiditis. It's frequently associated with that. It can lead to some types of cancers. MS, it's huge in MS patients. And again, this is why I feel like it's frankly criminal that the conventional medical system doesn't do more to look at this because it's so evident in the literature. It's not some crazy whacked out idea out of left field. It's like it's right there in front of us. And we do have the testing for it, but the problem is that a lot of practitioners don't know how to interpret the tests. and then they don't know how to treat. And I think they do feel a little bit insecure with the treatments. And I see too many doctors, like I said, undertreat it, not just with the dosage and not just with not doing enough things, but also not doing it long enough. I often find that people need to treat these for 3 months, 6 months. Some people need to be on some mild thing, one or two herbs or something for a year while they're working on their other root causes. But the thing that's empowering about this is that once you know what got you into this, and once you get into a place where you have more energy, you then know what your body has a susceptibility to, and you then also have your toolkit to know what to do when this happens. So for myself, years ago, my dad was dying, and it was a very beautiful deathing experience, and I was very hands-on with it. And I remember coming home one night and opening my supplement cupboard and going, this is a life stressor. When I'm doing great now, but when my dad dies, I'm going to be so freaking sad. And this would be a great opportunity for that Epstein Barr virus to have a party in my cells because I am going to be
Mm.
focused on something else. And so I started taking more of the antiviral herbs that I usually take. And I know that I stopped myself from having a relapse. I know I did. And it was just that little proactive thought. And this is something that I always want, those of you who are listening, just know that like as you're in your healing journey, as you begin to uncover your which health foundations need addressing and your root causes, and you start figuring out what works for your body, because some of you are more energetically sensitive and need the energy medicine, some of you need are more dense and you need the bulldozers, whatever you need, you have your toolkit, and then you always have that available to you. So then you become empowered in your own personal care, which I really think is really the best way to do medicine. It's like when you're using your providers as guides and support, because we have studied a lot, we do know a lot, Dr. Yarnell, and I mean, you've studied so much. It's like we know how to see patterns that maybe you can't see when you're in it, but when you were experiencing this, you're the one that really, it's about you for the healing, digging into.
Yes. And I love the way that you put it. You call it empowered self-care,
Yeah, 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 yeah.
which is what we should all be educated in, right?
Yeah,
Because this is our own body,
totally,
not somebody else's. We know
totally,
best.
totally, totally. Yeah, it's our own body. And I always talk about that we're this physical body, but we're also this mental, emotionless, energetic body as well. And I think for me, when
Mhm.
I was really sick all those decades ago and in bed, I didn't understand that. Like, I didn't understand why I was so sick, but my emotional body was like, oh my gosh, like I'd lost 5 people and had lost 2 babies in 1 year. I was like,
Oh my
and my
gosh.
physical body had been pregnant twice and had hemorrhaged and lost a bunch of blood. It's like, and then, but on an energetic level, I just didn't, it's like I didn't, it was like this amorphous thing and I didn't even know what it was. We talk about this energetic system in naturopathic medicine, but what is that? Where is it? How do you work on it? How do you make sure you're not taking on other people's energy? How do you keep that clear so that your physical body and your emotional body can all work together? And I think that's something that I've come to understand more as I've aged and practiced more and done more things. But I think that that's also really important in this day and age, is that we stay in our know how to clear our own energy and stay in our energy field, because I think that we then attract the information that we need for our healing and for our life.
Well, this has been such an interesting conversation. I almost hate to wrap it up, but I know that we do need to start on our conclusions. Is there anything that you'd like to say to the listeners that you'd like to leave them with? Maybe if somebody is suffering from this chronic fatigue and can't seem to get out of it?
Yeah, so I think the number one thing I'd say is never give up hope. Just never give up hope, because I always believe there's a way for your body to turn on that healing response and for your body to get back into balance. And it's so easy to try something and oh, it didn't work. It worked for Sally, but it didn't work for me. And it's like keep knocking on doors, keep trying. I know there are days that are frustrating and hard, and go ahead and feel those feelings, but then get yourself back up the next day and figure out what is it that you need, because I know one of those doors is going to open for you and it's going to make a huge shift in your life. And then when you get back into feeling your energy again, it's so exciting and so great. And the world needs you out there doing your thing. You're not meant to be sick and tired. So stay on that healing journey.
that's such a beautiful thought to leave with. How can people find you?
They can go to my website, which is drjennytufenkian.com. That's DRJENNY, T as in Tom, U, F as in Frank, E, N as in Nancy, KIAN as in Nancy.com.
Great. And I will also have that in the show notes, of course. So I can't tell you how much I appreciate this conversation. I think this was so enlightening and so different than what we might normally hear out there in the medical world. So information that we should all know. Thank you so much. I really appreciate it.
Thank you so much for having me. It's a pleasure. I love what you're doing here in the podcast, talking about inflammation. And thank you so much for all of your amazing work. And I can't wait to read your book.
Yay, yay. So, for all of you listeners, we will see you in the next episode. And that's another case filed on the Inflammation Investigator. Remember, every symptom is your body's way of communicating. We just need to learn the language. If today's episode sparked something for you, I want to hear about it. Share your own investigation discoveries with me on social media at Elizabeth Yarnell, or find me at elizabethyarnell.com. Your experience could be exactly what another listener needs to hear. And make sure you're subscribed so you never miss an episode. And here's the thing about investigations. They work best when you're not going it alone. If this podcast is helping you uncover the answers you've been searching for, please like, rate, subscribe, and review, and share it with someone who needs to hear this message. As a new podcast, these actions mean more than you know. Want to dive deeper into your own inflammation investigation? Head over to inflammationinvestigator.com, where you can take my free inflammation quiz to uncover which hidden triggers might be affecting your health. Until next time, this is Elizabeth Yarnell, your inflammation investigator, reminding you that the solutions to your health issues are out there. Let's find them together.